Welcome to the International Journal of Paramedicine podcast. I'm Mick Gunderson, the editor-in-chief. For this podcast, I'll be interviewing Siyaphera Makunganya to discuss the paper he co-authored, Strengthening EMS in Malawi, Piloting World Health Organization Basic Emergency Care for Prehospital Providers in Zomba, Malawi. The paper was written by Malawi and Makunganya, and it appears in IJOP issue number 11 for July-September 2025. This manuscript will be open for discussion by the paramedicine community at large on the NEMSMA email listserv, which is located on Google Groups at groups.google.com/G/NEMSMA, NEMSMA. You're invited to go there to ask questions and make comments about this and other IJOP papers. And the goal of these discussions is to get you and other paramedicine professionals participating in scholarly conversations about these papers to help advance our discipline. Our editorial team will then curate the best parts of these email discussion threads so they can be published in the dialogue section of the journal, which is our version of the traditional letters to the editor section. If your question or comment is selected for the dialogues, you'll be officially cited. So please participate in these discussions to make your voice as a paramedicine professional heard. Now here's the interview. Welcome, Sia. Thanks for agreeing to do this interview to talk about your paper.
Thank you so much, Mick.
So, Sia, I'd like to begin with some information about your background. Can you tell me a little bit about your role and experience in EMS and your education?
My role in the EMS, I should mention that I have the strong passion for the EMS. For that, I founded the company called Zomba Private Ambulances. It is, I should say that it's the only company that is existing in Malawi that is 100% just handling ambulance services. In terms of the academic background, I don't have that strong qualifications. So professionally, I'm not a medical person, but I'm more into emergency responses. That's what I've studied in my postgraduate studies. And then I have acquired several professional certificates for basic first aid and advanced first aid. So quickly, that's my background. But I should mention that what is underlining is the passion to see the change in the EMS sector in Malawi.
Well, that is just wonderful. I'm so happy to hear that you took the initiatives to start the ambulance service. With regard to the manuscript, what was the problem that you and your co-author were trying to fix with this particular project?
Correct. Oh, thank you so much. So this manuscript, what we were trying to address was the retention of the knowledge which healthcare providers, especially those that provide first aid or that accompany the ambulances, wanted to check the retention of the knowledge that they have, because there are various levels of cares that are used in the EMS. Some have very good knowledge, others are just first aiders, others are very well qualified to be the EMTs. So, but we needed to know, because they all respond to the emergencies. So we need to know how well do they can they retain the knowledge that they have, as well as to check which areas can the WHO basic emergency care guidelines, which areas and how best can they fit in so that they improve the quality, because the goal is to improve the quality of the services that are being provided in the EMS. So that's what we are trying to check in the manuscript.
And what curriculum were you using for training the personnel?
So we used the WHO basic emergency care curriculum, so which gave us the guidelines on what, especially the content, how deep the depth of the coverage of the content to be used in the assessment. So we used that, and it guided us and took us through. We were able to segregate the the workers, and he captured what we wanted to do.
Very good. So you implemented the curriculum and made some measurements of their knowledge retention. And what did you find? Was the curriculum successful, and were people able to retain the information?
No, the results were so much interesting because there were some that got worse than before. So what happened was we first of all trained them. So all of them, they were trained, and then they were assessed on the pre-knowledge and then after knowledge. So on the assessment, some especially the first aiders that were not very well qualified, it was found that before the training, when they were there in the pre-assessment, they got they had very good grades, and then the post-assessment, very bad grades, which was which was supposed to be the other way around. Well, before the assessment, before the training, they were supposed to perform poorly, and then after the training, they're supposed to perform very good. But all that, and then those that were qualified, our EMTs, we use nurses as our EMTs. So the EMTs, they performed very well. It was the first aiders, those that have limited basic knowledge, don't have that basic baseline knowledge in the EMS or in the medical field. Those are the ones that struggle to really capture knowledge correctly. So that that alone spoke a lot of weight in our hands when we were writing. Yeah.
Given that you had this experience, what impact do you hope that your work will have on other EMS training programs in your region or even other parts of the world?
No, the WHO basic emergency care guidelines or the curriculum, it has been well packaged in the sense that if this can be done regularly, it can improve the services on the ground, because we were able to see how now after the training. I should mention that after the training, how people now were working in the ambulance, it's just tremendous. I could see it on my own after the training and after doing the assessment, where I was able to see that people are now active and they were able to apply what they learned during the training, although they failed, but they were able to apply the knowledge on what they gained, and that gave me the energy to say, if this can be transferred or can be done in other parts of the not just my city or where I'm working, but if this can be done in all other sectors, in all other districts, this can just revolutionize the whole sector of the EMS in Malawi. That's what I'm hoping to see other providers, because I know there are some other providers elsewhere that did not attend the training, and those, if they can also be trained, because they respond, if they can be trained, they can really improve their services and improve the quality especially improving the quality of the services that they're providing in the EMS.
Well, no, that's wonderful, Sia. Thank you so much for taking the initiative to not only start the ambulance service, but to try to elevate the level of training for your providers. And I'm glad that you're seeing some positive impact from that. So I'd like to ask our viewers and listeners to please check out the full manuscript of this paper in our July-September 2025 issues, and then go to the NEMSMA listserv to ask questions and make comments. We also invite you to subscribe to the IJOP channel on YouTube and your favorite audio podcast platform to watch or listen to other interviews, abstract presentations, and IJOP content. So for the National EMS Management Association and the entire journal staff, thank you for watching or listening.